So no matter what cardiac pathology you have, there are some general cardiac treatment measures and diagnostics that they do. There are some general medications that you should be familiar with because your patients will be on them. And while it is outside of the scope of our practice to recommend, discuss, or prescribe medications, a lot of times we have to answer questions about them. And the best answer is, of course, follow your doctor's directions and ask your doctor. But we should know the implications of these medications, and we should know the implications of how these medications are going to potentially affect our therapy session. So that's pretty important. And there will be questions on the board exam about that, I promise. Or, probably. I don't make the board exam questions. Somebody else does, but they think this is pretty important. So you should be familiar with the diagnostic tests for cardiac function. So when somebody says, like, oh, I had an exercise stress test, you should know what they're talking about. You should be familiar with the names and functions of the major cardiac drug classes. It is not possible, unless it's your field, to keep up with all the different names of all the different drugs. But there are major classes of drugs that we should be familiar with. All healthcare professionals should be familiar with. I would like you to be able to list 3 ways that a regular exercise program can improve cardiac function. So in the general treatment for cardiac conditions, exercise is a big one of them. And that's our wheelhouse. That's where we can really help people. We can monitor their vitals while they do exercise. So that's always a good thing. And make sure that exercise is appropriate for them. So the general diagnostic tests for cardiovascular function, electrocardiography, we looked at the EKG. A lot of times they use it in the initial diagnosis and monitoring of dysrhythmias, myocardial infarction, infection, and pericarditis. It is done as a quick screening, is just part of your routine. As you get older, when you go to your normal wellness checkups, they'll do an EKG to just make sure your heart's still doing what it's supposed to be doing. If you have issues, they'll also do an EKG. And it takes like 5 seconds. It used to take longer, but now they just stick the thing on you and it's like, boop, you're done. So yeah, it's amazing how fast they are now. Auscultation is listening through the stethoscope, and that is a diagnostic test for cardiac function and for lung function. And we'll talk about that in the next chapter. Respiratory function, we'll talk about lung auscultation, and that is something that you might do in physical therapy. One of the things they're looking for when they do it diagnostically is to determine valvular abnormalities. Remember, I talked about the lub-dub, and if you don't have the lub or the dub, if you have a whoosh whoosh or a lub whoosh or something, then there's something wrong with your valves. So you can find out a lot by listening with the stethoscope. Echocardiography is like an ultrasound for your heart, sort of, if you want to think of it that way. It's a specific procedure, and it's used to record heart valve movements, blood flow, and cardiac output. So that's one of the ways of truly measuring cardiac output, is through an echocardiogram. They can measure it during the test. Exercise stress tests are used to assess general cardiovascular function. So an exercise stress test is the one you've probably seen pictures of it or something like that, where someone is running or walking on a treadmill and they have monitoring equipment on them. Obviously, not everyone is appropriate for an exercise stress test, and so that's something to be considered. But that is something that they do. So basically, they see how your heart reacts to exercise and how your vitals react to exercise. Chest x-ray films are used to show the size and the shape of the heart. Nuclear imaging, if they're trying to assess blood flow, they can tag certain blood cells and they can see how they go through the heart. Pretty cool, right? Tomographic studies are basically, it's like an x-ray, except for the computer slices it into little slices. So CT scan is what they call it. Cardiac catheterization measures pressures inside the heart and assesses valve and heart function. So they actually stick a catheter up through one of your veins and go up into the heart, and a lot can be done. So sometimes when they're doing cardiac catheterization, not only are they assessing and doing diagnostic things, they're also fixing things, like maybe they're opening clogged coronary circulation, or they are putting in stents. That can all be done during cardiac catheterization. There is a relatively new procedure that's called a transarterial valve replacement, where you can get your valves replaced without having to have open heart surgery. And it is a game changer for people that cannot have open heart surgery. So it's amazing. Angiography is the visualization of blood flow in the coronary arteries. So really, they're trying to assess like how patent, how open are your coronary arteries, and is your heart at risk? Because remember, the coronary arteries supply the myocardium, and that's critical to function. Doppler studies assess blood flow in peripheral vessels. A lot of times, if after surgery it's suspected that somebody has a deep vein thrombosis or a clot, they will do Doppler studies to clear them. And it records the sounds of blood flow or obstruction. A lot of times Doppler studies are done on the carotid arteries, make sure those are open, so you're not going to have a stroke and deprive your brain of oxygen. Blood tests look at the lipid panel, looking at levels of serum triglycerides, cholesterol, and they get your HDL and your LDL levels. And we'll talk about the different types of cholesterol. Sodium, potassium, calcium, other electrolytes, of course, very important in cardiac function. Arterial blood gas determination, it checks the current oxygen levels in your arteries, and it checks the acid-base balance. And we know that's important because CO2 is not usually carried bound to hemoglobin the way oxygen is. It's in the blood as bicarbonate ion, as part of that buffer system to keep our acid-base balance correct. And remember, acidosis or alkalosis can both those can kill you, and so it's important to know that those are correct. So an arterial blood gas, it's drawn by the respiratory therapist. They do an arterial stick, which it's really interesting to watch if you ever get a chance. But that's usually done by respiratory therapy. General treatment for cardiac disorders, dietary modifications. We can do that, right? Decrease total fat intake, general weight reduction, and reducing salt intake. The salt intake is going to affect your fluid balance, and so it's not, that's a usual recommendation for cardiac disorders. Regular exercise program. So 3 reasons, this is one of the learning objectives, 3 reasons, 3 effects that a regular exercise program has on your cardiac health. It decreases high density lipoprotein levels. Increases. The HDLs are the good ones, and the LDLs are the bad ones. So we want to increase HDLs and decrease LDLs and decrease overall total cholesterol. So you can think of HDLs as happy lipoproteins and LDLs as lousy lipoproteins, if you want to, whatever it takes for you to remember them. And exercise also reduces stress levels, which has an effect on the sympathetic nervous system and has an effect on the cardiac system. You know, I'm sure that you all know by now that smoking's bad for you. So if you do smoke, I don't think anybody does, but if you do, quit. It decreases your risk of coronary artery disease. So smoking's bad. Don't do it. I don't know what more to say about that. The general drug therapy for cardiac disorders, vasodilators, they reduce peripheral resistance. Remember, if you reduce peripheral resistance, you can increase stroke volume and increase cardiac output. The heart doesn't have to work as hard. Beta blockers, they actually block those sympathetic receptors, and they treat hypertension and dysrhythmias with beta blockers, and they can reduce the frequency of angina attacks. So beta blockers will, if you decrease the sympathetic response, you're going to decrease the heart rate. So they keep your heart rate artificially low. So if you are working with a patient, this is a good thing to know. If you're working with a patient who's on beta blockers, you will not be able to use their heart rate to monitor their exercise level because their heart rate is being kept artificially low by the beta blockers. So you have to use perceived exertion to monitor their exercise rate, and that's something you should teach them to do. So that's pretty important. If you know if your patients are on beta blockers, and sometimes they use it for anxiety as well. So people without cardiac issues also might be on beta blockers. So that's a good thing to know about your patients if they're on beta blockers. Calcium channel blockers decrease cardiac contractility. So they're used as antihypertensives and vasodilators, and they're prophylactic against angina, which is chest pain. So anything that is a vasodilator can help protect against angina, and the treatment for angina is usually to take a vasodilator. Digoxin is usually used as a treatment for heart failure or as an antidysrhythmic drug for atrial dysrhythmias. It's a pretty toxic substance. It does have that effect on the heart, and so it's used in sometimes when other things don't work, and it's been around for a long time, so it has a long history, and they kind of know how people are going to react on it. When people are on digoxin and a lot of these things, they're seeing a cardiologist pretty regularly. So any issues they have with that should definitely be referred back to their cardiologist. Antihypertensive drugs are used to lower blood pressure. A huge proportion of our patient population is on antihypertensive drugs, and there are several different types. So the most common is a diuretic, which is going to cause you to get rid of more fluid. So lower blood volume, lower blood pressure, makes sense. ACE inhibitors are another common one, and sometimes you'll see a combination ACE inhibitor diuretic pill. Androgenic blocking drugs act on the central or the sympathetic nervous system centrally or in the periphery. So they're trying to decrease the sympathetic response. Again, you're going to see heart rate changes with patients that are on the androgenic blocking drugs. Angiotensin converting enzyme, or ACE inhibitors, block the conversion of angiotensin 1 to angiotensin 2. So those are the ACE inhibitors that I talked about. The most common one that you see that people are on are lisinopril, and that's a pretty common blood pressure medication. A certain percentage of people get a histamine response to lisinopril that causes them to have a dry cough. They usually switch them to a different drug at that point. Diuretics remove excess sodium and or water, so they change your blood volume. So they're used to treat high blood pressure and congestive heart failure. So congestive heart failure, you get excess fluid and in a different way. So diuretics are used for both of those. A lot of times for heart failure patients, they're using their body weight as a measure of how much excess fluid they have, and that determines their diuretic dosage. If it's being used to treat high blood pressure, you're usually on a consistent dosage every day. Anticoagulants reduce the risk of blood clot formation. So the simplest one is taking a baby aspirin, 81 milligrams of aspirin every day to reduce blood clot formation. Then there are the ones like Plavix and the ones that reduce platelet adhesion, and so they keep clots from forming. Then there are ones like Coumadin and heparin, which also keep clots from forming. That's a good thing to know about your patients. If you're doing instrument-assisted soft tissue mobilization and people are on long-term anticoagulant therapy, you can have some issues with petechiae and bleeding because they're on the anticoagulants. Cholesterol-lowering drugs like statins are used to reduce LDLs and overall cholesterol levels. So a lot of times, the way my sister put it is, you're old when they put you on a statin. A lot of people go on statins. We'll just leave it at that. They're cholesterol lowering drugs. So this is the chart from the book that has kind of general, has names of drugs, what they're used for, their action, and adverse effects. So the adverse effects are a thing that we want to know about. So dizziness, fatigue, weakness, dizziness, a lot of dizziness with these. So that's something to know about your patients if they're going to potentially have that side effect from cardiovascular medication. So knowing what medications your patients are on is important so they can have a safe and productive exercise session with you.